Arthritis, joint pain, exercises for joint pain relief. Do your joints feel stiff when you wake up in the morning? Does it hurt when you bend your knees or move your fingers? If yes, you might be experiencing arthritis, a common condition that affects millions of people around the world. Arthritis isn't just one disease. It's a term that includes many joint problems. The most common are osteoarthritis and rheumatoid arthritis. Osteoarthritis happens when the cartilage, which cushions your joints, wears down over time. Rheumatoid arthritis, on the other hand, is an autoimmune condition. It makes the immune system attack healthy joint tissue by mistake. No matter which type you have, arthritis can make everyday activities painful. Walking, climbing stairs, cooking, even writing can become difficult. But here's some good news. Regular gentle exercise can help you manage pain, strengthen your muscles, and keep your joints flexible. In this video, we'll explore the best exercises for joint pain relief, how they help, and how you can safely include them in your daily routine. Let's begin. Sun behind small cloud 1. Why exercise matters for arthritis. Many people with arthritis are afraid to move because they think it will cause more pain. But actually, the opposite is true. When you stop moving, your joints become stiffer, your muscles weaken, and pain increases. Exercise acts like natural medicine. It keeps your joints flexible, improves circulation, reduces stiffness, and even boosts mood by releasing endorphins. Think of exercise as oil for the joints. Just like a door hinge that squeaks less when it's used regularly, your joints also stay healthier when they move gently and consistently. Even small movements done daily can make a big difference. Palms up together 2, gentle warm-up 5 minutes. Before starting any exercise, it's important to warm up. A proper warm-up helps your muscles and joints prepare for movement, improves blood flow, and lowers the risk of pain or injury. Here's a simple warm-up you can do. Neck rolls. Slowly tilt your head from side to side. Roll your neck gently in circles. Don't rush, move slowly and breathe deeply. Shoulder circles. Lift your shoulders up, then roll them backward and forward 10 times. This helps reduce tension in the upper body. Arm swings. Swing your arms gently from front to back. This movement increases circulation and prepares your shoulders. Ankle rotations. Rotate your ankles clockwise and counterclockwise. If you have ankle pain, move slowly and keep it light. Just 5 minutes of gentle warm-up can make your main exercises much more comfortable. Raised hand 3, hand and finger exercises. Arthritis often affects small joints, like those in your fingers and hands. Simple finger exercises can make daily tasks, like buttoning clothes or holding objects, easier. Try these. Make a fist. Close your hand slowly into a soft fist, then open it wide. Repeat 10 times. This increases flexibility and reduces morning stiffness. Finger bends. Bend one finger at a time toward your palm and hold for 2 seconds, then release. This helps improve joint movement. Thumb stretch. Touch your thumb to the base of your little finger. Hold for 5 seconds and relax. Repeat several times. If your hands feel sore, you can also dip them in warm water before starting. Heat relaxes muscles and increases circulation. Leg 4, knee and leg exercises. The knees are among the most commonly affected joints in arthritis. Strengthening the muscles around your knees can reduce pain and help you move better. Chair leg raises. Sit on a sturdy chair. Straighten one leg slowly, hold for 5 seconds, then lower it. Repeat 10 times for each leg. This exercise strengthens your thigh muscles, which support your knees. Seated marching. While sitting, lift one knee toward your chest, then switch to the other leg. Keep alternating for 1 minute. It improves circulation and joint movement. Wall slides. Stand with your back against a wall. Slowly slide down as if sitting in an invisible chair. Hold for 5 seconds and go back up. Don't go too low if you feel pain. Do 5-8 repetitions. Walking and light cycling are also excellent low-impact exercises for knee arthritis. Avoid jumping or running on hard surfaces, as that can stress your joints. 5 hip and lower back stretches. The hips and lower back bear most of your body's weight, so keeping them flexible is essential. Knee to chest stretch. Lie on your back, bend one knee, and gently pull it toward your chest. Hold for 10 seconds, then switch sides. Repeat 3 times per leg. Hip rotation. While lying on your back with knees bent, keep your feet flat on the floor. Slowly let your knees fall to one side, then to the other. This loosens tight hips and relaxes your lower back. Standing hip circles. Hold onto a wall or chair for balance. Lift one leg slightly and make small circles with your hip. Do 10 circles in each direction, then switch sides. These gentle stretches help relieve stiffness in your hips and improve your posture. Foot 6, ankle and foot mobility. If you have arthritis in your ankles or toes, daily mobility exercises can prevent stiffness and pain. Toe flexes. Point your toes forward, then pull them back toward your body. Do this 10-15 times. Ankle rotations. Lift one foot off the ground and rotate your ankle slowly. Make 10 circles clockwise, then 10 counterclockwise. Heel raises. Stand while holding a chair. Lift your heels so you're on your toes. Hold for 3 seconds, then lower. Repeat 10 times. These exercises improve circulation, balance, and foot strength, all crucial for comfortable walking. Person in lotus position 7, stretching and flexibility. Stretching keeps your joints flexible and helps prevent stiffness after sitting for long hours. Shoulder stretch. Place one arm across your chest, hold it with your other hand, and stretch gently for 10 seconds. Side stretch. Stand tall, raise one arm overhead, and bend slightly to the opposite side. You'll feel a nice stretch along your waist and ribs. Cat-cow pose from yoga. Get on your hands and knees. Arch your back gently upward, cat pose, then lower it down while lifting your head, cow pose. This movement keeps your spine healthy and relieves tension. You can do these stretches every morning or before bed. It's a simple way to maintain mobility. Herb 8, the role of breathing and relaxation. Pain and stress are closely linked. When you're stressed, your muscles tighten and pain feels worse. That's why relaxation and breathing are powerful tools in managing arthritis. Try this. Sit comfortably and close your eyes. Inhale deeply through your nose for 4 seconds, hold for 2 seconds, and exhale slowly through your mouth. Repeat this for 1-2 minutes. This reduces tension, improves oxygen flow, and helps you feel calmer. You can also try light meditation or gentle yoga, both proven to improve arthritis symptoms and emotional well-being. Jigsaw 9, tips for exercising safely with arthritis. Start slow. Don't push yourself too hard. Begin with small movements and increase intensity gradually. Listen to your body. Mild discomfort is okay, but stop if you feel sharp pain. Consistency is key. It's better to move a little every day than to overdo it once a week. Use heat or cold. Warm compresses before exercise can ease stiffness, while cold packs after can reduce swelling. Stay hydrated. Joints need water to stay lubricated. Drink plenty of fluids throughout the day. Footwear matters. Wear supportive shoes that absorb shock and help balance. Remember, your goal is not to run a marathon, but to keep your joints moving and pain under control. Sun with Face 10, lifestyle habits that support joint health. Exercise works best when combined with healthy lifestyle choices. Eat anti-inflammatory foods. Include omega-3 rich fish, olive oil, green vegetables, and berries. Avoid processed foods and excessive sugar. Maintain a healthy weight. Every extra kilogram adds pressure on your knees and hips. Losing even a little weight can reduce joint stress significantly. Get enough sleep. Rest helps the body recover and reduces inflammation. Stay positive. Arthritis can be frustrating, but a positive mindset helps you stay consistent and motivated. Hibiscus final thoughts. Arthritis may not have a permanent cure, but it doesn't mean you have to live in constant pain. Gentle exercises combined with healthy habits can help you regain control over your body and life. Just 10-15 minutes of daily movement can improve flexibility, strengthen muscles, and make your joints feel more comfortable. Remember this phrase: motion is lotion for your joints. The more you move, the better your joints will feel. So stand up, stretch a little, and take the first step toward a healthier, pain-free life, starting today. Stay active, stay strong, and take care of your joints. Green Heart.